know is if you have an accident, you do want to stop, because we do not want to hit and run on our hands. Don't ever leave the scene of an accident. The first inclination a person has after an accident is, oh my goodness, what just happened? A lot of times they don't even know what happened. Sometimes you have to stop and think, get your thoughts together. Did you do something wrong? Did the other person do something wrong? It pays to be quiet and think. So don't panic. Do is make sure you're okay. Check yourself, see how you feel. Did you lose consciousness? Are you alert? Is anything hurting? Can you move? Can you feel? If it's just a slight fender bender, chances are you'll just want to get out of your car, but make sure that your car is pulled to the side of the road so you don't block traffic. And then you can approach the other person, or the other person may approach you, and you want to exchange information. The police probably, in all likelihood, if it's a fender bender and no one is injured, will not come out. The exchange of information should be sufficient. You would want to get that person's name, address, telephone number, their driver's license number, their insurance card. Make sure you take down all of their insurance information. And once you've done this, you also give them your insurance information, your name, your address, your phone number. Once you get home, you probably will want to rest. However, before you lay down, make sure you pick up the phone and call your insurance company and let them know that you did have an accident. You will be given a number, that is your claim number. You may or may not be assigned an adjuster that day. It may take until 24 to 48 hours for you to actually get the name of an adjuster and a phone number to call. In the meantime, you should go on about your daily routine. If there were no injuries and you just want your car taken care of, then the adjuster will be contacting you, and they will send someone out to either look at your car, or if your car is drivable, they will have you drive your car to a location at an appointed time where they will have what they call a PD, a property damage adjuster, look at your car. Sometimes you're given a check on the spot, sometimes a check is mailed to you. Then you can take your car to have it repaired any place that you choose to have it repaired. Now, if you have been injured, that's a different story. What you want to do is to go to the emergency room if the injury so warrants, meaning if you're in a lot of pain or if you're really feeling very poorly, then you should go to the emergency room, because there may be some injuries there that are not obvious to the eye, and it could actually be serious. Now, if you are just feeling a little bit poorly but not really bad, and you think you're pretty much so-so, wait until the next day and go and see your treating physician. When you see your treating physician, explain to him exactly where you're having any kind of pain whatsoever. And also let your physician know any illnesses that you have, any medication that you're taking. Your physician will then prescribe a treatment program for you. This generally consists of some type of therapy. If you have a neck strain, back strain, they generally prescribe things like ultrasound, electrical muscle stimulation, massage, things of this sort. Because what it does is, especially the therapy, it goes down to the bone. And when it does that, it helps reduce the swelling, and you should be feeling a lot better, a lot faster. And what happens is oxygen is taken into your blood cells, and that helps to expedite the healing process. So these are some of the things that follow a motor vehicle accident. Basically, remember to stay calm, keep your cool, remember what happened during the accident. Sometimes you don't know right off the bat, but once you sit there and think for a while, start to remember certain things, you eventually remember pretty much exactly what happened. Then notify your insurance carrier. If you need to seek medical attention, you do that.